Today we're going to discuss the data ecosystem in Saskatchewan and a bit of the future vision for that data ecosystem. In Saskatchewan, data does not all live in one place. It is collected by private clinics, health authorities, health organizations, and more. Each of these data trustees is legally responsible for the data they collect. Until recently, if a researcher wanted to access data, they had to pursue a data sharing agreement with each data trustee for each of their projects. This was both inconvenient and time-consuming for both researcher and data trustees, as agreements often took as much as 18 months to complete. This delayed research completion and limited how many researchers were able to use these data sets. Instead, many opted to collect their own survey data or do chart reviews. When researchers did gain access, they often had to work with aggregate data or work in a specific data lab in Saskatoon to complete their analysis. This decreased research jurisdiction and decreased researcher competitiveness in funding applications. These data limitations also led to Saskatchewan patients not being represented in national studies. To begin to address some of these issues, the 7 health partners shown on screen signed a Master Health Data Sharing Agreement in August 2022, which eliminated the need for time-consuming one-off data sharing agreements, while maintaining trustees' responsibility to assess research requests in alignment with provincial legislation, including the Health Information Protection Act. In the agreement, it was agreed to share data for secondary purposes using a central repository and a standard data access request process. The partners also agreed to integrate their data into a central repository with eHealth Saskatchewan serving as the information management service provider. The Master Health Data Sharing Agreement covers all secondary uses of health data, that means research analysis or health system planning. It therefore enabled the creation of the Health Research Data Platform Saskatchewan. In the future, the MHDSA can help to enable health data access for other secondary purposes, such as health system planning. The MHDSA and the HRDP Saskatchewan do not address primary data uses. The first use of the MHDSA was the creation of the Health Research Data Platform Saskatchewan through a collaboration by staff and leaders in the 7 partner organizations. It is funded by the Saskatchewan Centre for Patient-Oriented Research and the Health Data Research Network Canada. SCPOR supports and advances patient-oriented research in Saskatchewan. HRDP Saskatchewan is one of the ways SCPOR builds capacity for responsive, innovative healthcare in the province. HDRN is a pan-Canadian network of member organizations that either hold linkable health and health-related data for entire populations or have mandates and roles relating directly to access or use of those data. HRDP Saskatchewan is not a standalone system. Rather, it functions within the eHealth data ecosystem. In the slides ahead, this ecosystem will be explained as it is today and proposed future opportunities. As explained earlier, in Saskatchewan, there are many different data trustees. These include those on the left-hand side of the screen, eHealth Saskatchewan, Ministry of Health, and the SHA. These data trustees all have source databases that are fed in through a variety of different tools like Informatica and Oracle into one or more of the 3 eHealth storage marts, which are pictured in the middle of the chart. You can see that sometimes different versions of the same data are integrated and used for different purposes. These slight variations may just occur due to timing or differences in what variables are included, creating different and overlapping data sets. Moving towards the right-hand side, variation exists in how access is provided to different types of users. For example, there are very many different analysis solutions that may be used depending on the data mart and end user. Having many different analysis tools can lead to gaps in support and a much higher risk of unsupported versions of technologies being in use for even years at a time. eHealth is visioning and working towards a future state that builds on the pilot work developed to support the HRDP Saskatchewan. This would achieve the vision of one copy of data used multiple ways and eliminate variation and risk. On the left, datasets from key sources all feed into a central data repository, within which standardized processes for data integration and data quality could be applied. Segments of data, as required by the end user, could then flow from the central repository into a unified cloud analytics environment. Unifying data infrastructure will make data flows more robust, sustainable, and secure. By standardizing input and output technologies, eHealth could improve technological support and enable access to best-in-class business intelligence tools for all system partners. This model would also enable federated data governance, wherein trustees oversee and approve both health analyst and research access through a privacy-protective standardized process supported by robust metadata and data dictionaries. Achieving this vision for a unified and efficient approach to data management in the province will require a unified team approach to change, including continued leadership and financial support, provincial data governance, expanded uses of the MHDSA, data alignment based on the philosophy of one copy of data used multiple ways, and standardized data documentation and quality processes throughout the system.